One of the exercises we're doing this year at the Center for the Future of Work, we're trying to understand how green is green and trying to figure out exactly where the investments are beginning to flow. And I think healthy buildings are going to be a big part of the mix, so to speak, on how organizations reduce their energy footprint. So I know you've done some work on energy and reducing energy. Can you give me an idea of how the health building and energy compliance or energy reduction sync? How do they sync together? How do we start thinking about that?
Yeah, clearly energy reduction or energy savings is a priority as we think about climate. And I want to be clear that when we talk about healthy buildings, we've been talking about a lot about us as the indoor species, but we also have to think about health beyond the four walls. So the decisions we're making in our buildings, particularly around energy, are also health decisions. And one of the ways we talk about it in the book, and we've quantified this, is to turn an energy conversation into quantified human health impacts. And let me describe it really quickly to put some numbers on it. So normally we say, okay, if you have an energy efficient building, you save some amount of money on energy, that's great. You've reduced some carbon, great. And what we do in the models, we say, well, let's extend that and say, if we reduce the demand on the grid, and that grid is burning fossil fuels, then you've reduced the amount of air pollutants that have an immediate health burden, and you've reduced the amount of greenhouse gases. We know this, but now we've quantified that. But here's where this co-benefits model, we call it COBE, co-benefits of the built environment, this tool will take it a step further. If you reduce air pollutants and greenhouse gases, we know that leads to fewer premature deaths, fewer missed school days, fewer missed work days, and we can quantify that and put it back in an economic metric. So we can do dollar per dollar, pound per pound, and say, for example, we did the green building movement. And in the US, for every dollar saved on energy, which is the primary driver of energy decisions, there's another 60 cents or so in health and climate co-benefits that have not been quantified. In the book, we give an example that we've taken this tool and applied it to portfolios, even a building. So if you build a new building, in this one example we give, they saved a couple $100,000 in energy. Well, it turns out they saved almost another $100,000 in climate and health benefits for their community. And that's quite a powerful argument for an organization. We saved energy, that helped us, but look at these social benefits we've provided based on our building decisions. It fits right into the ESG conversation too, but now we've quantified that.